Welcome to the Joint Intersectoral Analysis Framework, JIAF for short, session on indicators and severity. The JIAF is a multi-partner endeavor that brings together UN agencies, NGOs, and donors. This session is part of a broader training plan for JIAF 1.1. The plan is composed of 3 elements: 4 high-level pre-recorded presentations, 8 more in-depth blended sessions, and workshops and webinars. The first set of presentation is already available. It is composed of 4 high-level pre-recorded presentations that are actually about 15 minutes each. There are 4 presentations, one that gives a broad overview of the concept, methodology, and process, and then 3 other ones that focus more precisely on the concept, the methodology, and the process. The second set of presentations are more in-depth and pre-recorded blended presentations that include introduction to the companion tools, exercises, etc. And I would say that they're probably about 40 minutes each. This presentation is part of the in-depth blended learning presentation and focuses on indicators and severity. And now let's start digging on the JIAF. Concretely, the JIAF approach consists of 3 elements. First, a concept. Second, a methodology. And third, a process. The concept is that the analysis is intersectoral as opposed to multisectoral, with affected people as the starting point, and we'll get back to that in the coming slides. The methodology is articulated around 3 elements. First, an analytical framework, then indicators with severity thresholds, and third, an aggregation method for each of the data scenario that your team can face. The aggregation will then lead to the calculation of the number of people in need. Finally, in terms of process, we will see that it is very similar to the H&O process with which you're already very familiar. The plan for this session is to look at 7 elements. The first one is to provide an introduction to the JIAF framework and the severity as a whole, as a concept. Secondly and thirdly, looking at the indicators for the different pillars. The pillars for context, shock, and impact, and then the indicators for the humanitarian conditions pillar that are actually the ones used for aggregation and estimation of PIN. We'll have a look at the JIAF indicator reference table for the HPC 2022. It was updated this spring for JIAF 1.1. Then we'll be looking at crafting your own indicators in case you want to diverge from the JIAF indicator reference table. Then we'll discuss a little bit critical indicators, and finally something that has been quite tricky in the previous iteration of the JIAF is understanding the difference between magnitude and degree indicators. Indicators and severity are a part of the bigger JIAF methodology, which is composed of a framework that gives structure to how the information about the challenges faced by the affected population is organized. Using indicators. Each of those indicators is thresholded using the JIAF severity scale, and then processed, treated, and aggregated to visualize and help make sense of the data. Let's start with the framework. The JIAF is built around 5 pillars. First, the context. Second, the events and the shocks. Third, the impact. Fourth, the humanitarian conditions, and 5th, current and forecasted priority needs concerns. The framework serves to organize information and visualize relationships to bring a structure to the analysis. The analysis of the first three pillars on context, shocks, and impacts can be guided by the indicators and the methodology that is outlined in Annex 3 of the JIAF 1.1 guidance. The link to the set of indicators for those first three pillars is available at the end of this presentation and in Annex 3 of the guidance. Those indicators can help you illustrate the environment in which humanitarian actors plan and operate, but also the exposure of a population to different shocks and risks, also key vulnerability characteristics and impact of a crisis on affected populations and services. In Annex 3, you will also find further guidance for the consolidation of available information and those indicators. Now, let's zoom in on the humanitarian conditions pillar. The humanitarian conditions pillar is organized around three very interlinked humanitarian consequences. The first one is living standards, the second is coping mechanism, and the third is physical and mental well-being. The global clusters came up with indicators to illustrate the severity of needs for their sector for each one of those humanitarian consequences. Each indicator is thresholded to establish intersectoral PIN. The objective is to have a distribution of the population per severity class. For the entire humanitarian conditions pillar, it is actually not recommended to try to estimate an intersectoral PIN at the sub-pillar level due to the interrelated nature of the sub-pillars. Depending on the scope decided by the JIAF team, the analysis can be done at different level and distributed across the population at units of analysis decided by the team and the crisis level. It is also possible to do it per population group if it has been discussed and if, of course, the data is available. Measuring intersectoral severity is a central function of the JIAF. A couple of slides ago, I mentioned that indicators were thresholded. These thresholds actually refer to the scales in the severity scale reference table. Each of the indicators that are in the JIAF table contain a severity scale. When executed to its fullest potential, the methodology enables distribution of a total number of people in an area or affected group across the 5 severity classes, and that is when we use scenario A. The global clusters proposed a total of 123 indicators to feed into the JIAF framework. The sunburst visual on the right shows the 97 indicators used to estimate the severity of the 3 humanitarian conditions, being living standards, coping mechanisms, and physical and mental well-being. The 123 indicators are compiled into what is called the JIAF indicator reference table that you may have seen. It is a live Google spreadsheet, and the link is available at the end of the presentation. The global cluster coordinators elaborated those indicators, and for each of in the indicators, the information available are the sector, the subsector, which pillar the indicator fits in the JIAF framework, which subpillar, and the name of the indicator. Then you have a data collection technique associated with this indicator, in this case, the household survey, as well as the recommended source and assessment, where it's coming from. Then the global clusters indicated the thresholds and ceilings for each class of severity pertaining to this indicator. These thresholds and ceilings can be adapted to the context. And additionally, some clusters don't have fixed thresholds. And in that case, national clusters should reach out to their global counterparts for further guidance. This slide recaps the entire JIAF process. I just wanted to bring your attention to step 1, plan and design a joint intersectoral analysis process, and more specifically to step 1.5 and 1.6. Indeed, once the JIAF team has conducted the initial scoping and has agreed on the boundaries for the analysis, the next step is to review indicators and define sources for informing the humanitarian conditions pillar. It's also when it is time to identify the critical indicators for the humanitarian conditions pillar. We're going to look more into details into the selection of the indicators now. Once the exact units of analysis and disaggregation levels have been identified and agreed upon, the analysis team can start consulting with the relevant clusters and areas of responsibilities, as well as the main data providers, to review and identify which indicators will be used to populate this JIAF. If a specific JIAF household level indicator has multiple sources, for instance, if it's coming from a multi-sectoral needs assessment, or MSNA, or we have the exact same one from a sector-specific assessment, then the concerned sector should be able to decide which source should be used for that indicators. As mentioned earlier, the JIAF provides a working list of core indicators for the humanitarian conditions pillar, each accompanied by thresholds recommended by global clusters and categorized by subpillar. However, not all indicators and thresholds presented in this reference table has been tasted, and context adaptation may be possible. The review process should entail a facilitated discussion with the cluster leads and the main humanitarian stakeholders to review and select relevant and appropriate indicators for the context. The contextualization of JIAF indicators should follow 2 steps. First, the JIAF lead analyst should facilitate a discussion with cluster leads and the stakeholders to establish a list of basic goods and commodities, as well as services adapted to the context. This will allow clear identification of eligible indicators under the humanitarian conditions pillar compared to the impact pillar. For example, if the list of basic needs includes information, then indicators about access to information or risk education could be included under the living standards subpillar dedicated to measuring the ability to meet basic needs. If the list does not include complaints and feedback mechanisms, for instance, then those indicators will be placed under the impact and services and subpillars. The second step is once the list of basic needs is established, the analysis team will request the clusters and AORs to identify their candidate indicators for the JIAF. The selection of indicators should be documented and the metadata compiled into the data collection tool and eventually into the data aggregation tool. This screenshot shows the data collection tool for the indicators. And this screenshot shows how the indicators are organized in the data aggregation template, step 1, showing the indicator overview. For each indicator, the metadata that is required is very similar to that in the indicator reference table. We are looking at the cluster for the indicator, the subpillar, an ID for the indicator, the indicator itself, the class of the indicator. It can be either degree or magnitude. We'll get into more details about degree and magnitude a bit later into this presentation. Then the population group for which the indicator is collected. then whether it's a critical indicator or not, then the severity classes with the thresholds and the ceilings. Once the submitted indicators have been reviewed and contextualized, the analysis team should ensure that each indicator has an owner and a source. The analysis team should liaise with the respective clusters or with the main data providers to see how data can be obtained. In some cases, there are information gaps that cannot be filled otherwise, and then expert judgment elicitations can be organized to obtain the best estimates based on availability of secondary data. I will not get into the details of how the data is processed and aggregated. There is a dedicated session on this. If for various reasons the team in country doesn't find indicators in the reference table that are best suited to illustrate the humanitarian needs in their countries, it is possible to opt to craft your own indicators, but you have to follow core principles and the choices must be documented. If the team opts to craft indicators, 7 core principles must be followed. The first principle is validity, a clear relationship between the indicator and what is being measured must exist. The second core principle is the unit of analysis. The JIAF indicators can be either at a household or area level. The third core principle is transparency. Each indicator has a robust and accepted methodology or instrument attached to it. The fourth core principle is perhaps the most crucial. It is severity thresholds. Each indicator must have severity thresholds, preferably organized along a 5-point scale, but at a minimum, it must be a 3-point scale aligned with the JIAF severity phase definitions and humanitarian population figures. For instance, severity class 1 means not affected. Severity class 2 means being affected but not in need. And severity class 3 to 5 signified increasing level of needs. Binary indicators, like yes or no, are not recommended for the humanitarian conditions pillar, as they cannot be used for severity calculations as defined at this time. The fifth core principle is simplicity. Indicator is easy to understand and self-explanatory. The sixth core indicator is uniqueness. Indicators should be used only once in estimating severity of humanitarian conditions. This is to avoid redundancy and overweighing a particular indicator. The last core principle is disaggregation. The indicator must be collectible by sex, age, category, disability status as much as feasible. All the changes in indicators must be documented and communicated to the Global Cluster IMO for learning and further improvement purposes using the templates that are provided in the guidance. I'll also put them at the end of this presentation. You have a screenshot here. Once the submitted indicators have been reviewed and contextualized, the analysis team should ensure that each indicator has an owner and a source, and then the analysis team should liaise with the respective clusters or the main data providers to see how data can be obtained. Let's now take a step back from this presentation and try to apply a little bit what I have been presenting. Stop the presentation and go to the end of it to find the link to the JIAF reference table. Once you have it, have a look at the 123 indicators and ask yourself, in your country, which indicators are collected? Now, let's say that you haven't found the indicator that illustrates the best the deteriorating humanitarian situation in your country, and you want to craft your own. My second question is, based on the 7 core principles, can you craft an indicator that measures the severity of needs in health? Or actually any sector with which you are familiar with. Thirdly, document your choice of indicator that you've just crafted using the template. Finally, using the data collection template itself, fill the Indicator Overview tab. Please do take 5 or 10 minutes to complete this exercise. And if you're finding it difficult, perhaps rewind a few slides and go over them again. Welcome back. How did you find the exercise? What challenge did you encounter? How does it translate to real life, and how would you do it in your country? If going back to the slide didn't help, or if my explanations are actually not that clear, or you still have questions, please remember that we can also have clinics or troubleshooting sessions to address some of your specific questions. You can also contact your counterparts at the global level, whether it be within OCHA, NARAS, or within the global clusters. We also have a help desk that could support you. I'll put the email at the end of the session, but it's actually quite easy. It is jiafhelpdesk@gmail.com, all attached, all together. Right, now that we've discussed what is the actual guidance on how to craft indicators, I just wanted to say a few words about discouraged practices. 3 things are not recommended. The first one is, please don't use a sector pin as a measure of severity in the humanitarian conditions pillar. Sector pin, when already calculated, will be used at a later stage as part of the review and finalization of JIAF and sector findings. The second not recommended practice is the use of response indicators, as they are not needs-related indicators. For instance, the percentage of population who have received or not received assistance should not be included in the JIAF, as they are not needs-related. They can be used separately to calculate gaps in response and inform the projection of needs. Finally, please do not use risk indicators. They should be used only to support JIAF risks. And now on to our next section on critical indicators. The selection of critical indicators is an important step in developing a JIAF severity model that can appropriately capture and classify high severity levels. Identifying critical indicators will be important when it comes to aggregation and overall severity classification. Critical indicators correspond most directly to time-critical, life-threatening consequences, and as such, the JIAF analysis team must ensure that these indicators at the highest severity levels, that is to say severity 5, equate to imminent death. Indicators from well-established analysis methodologies whose severity indices relate to imminent death in the highest categories should therefore be given precedence in the selection of critical indicators. The chief example of this is the Integrated Phase Classification, the IPC, for acute food severity, AVFI, or acute malnutrition, the AMN, and Cadre Harmonisé, whose severity classification should be treated as critical indicators. In the longer term, however, the JIAF will seek to adopt a universal severity scale, where each indicator in the reference table is aligned with the JIAF scale, but this will take more time and study to be fully executed. The identification of critical indicators is a temporary solution as the JIAF develops towards this goal. Critical indicators are used in two ways by the JIAF. The first way is when the aggregation results are scrutinized by the subject matter experts to ensure that these indicators are compared against the aggregated results, and if necessary and appropriate, the critical indicators can lead to an override for the final severity score. The second use of critical indicator within the JIAF is in the expert analysis to provide more disaggregated findings on top of a severity class of a 25% most in need and identify pockets of severe needs within areas. It's especially true for scenario B, and we'll provide more details on that use in the dedicated session on aggregation and analysis. In the previous slide, I just mentioned that critical indicators could be used to override severity. The same is not true for PIN. In other words, critical indicators PIN should not be used to override the JIAF calculated PIN all by itself. The PIN should be defined based on the calculations yielded by the JIAF methodology, but also based on expert judgment, taking into account not only the critical indicators, but a wider array of sectoral indicators. In some situation in 2020, the JIAF analysis teams used the maximum PIN across critical indicators to determine the overall intersectoral PIN in lieu of expert judgment. While it is highly recommended to ensure expert judgment takes place, we would recommend that in such a situation were to arise again, the calculation should never be limited to critical indicators only. Use an array of sectoral indicators. The use of critical indicators was identified as a difficult element of a JIAF 1.0. So we've added all this new information about how to craft critical indicators and how to use them. We've also added a table that provides a list of examples of critical indicators as identified at the global level. However, it is important to note that these examples are meant for reference only, and different critical indicators can be identified as relevant in a given context. The purpose of this table is not to provide a prescriptive list of indicators that can be used as critical, but rather to illustrate how these indicators should be identified to align with the definition provided in the previous slides. As the definition as well as these examples illustrate, it can therefore be possible that in a given context, there are either no critical indicators at all, or there are only one or two critical indicators to be considered in the intersectoral analysis. The global thresholds for severity column has been added to demonstrate how each of these example indicators align with the definition for critical indicator that we gave before, and the requirement for having a severity 5 threshold that equates to imminent death. This does not mean that only a critical indicator with a score of 5 can be used to determine the overall severity. Any given score for a critical indicator can be used for this purpose if this is found to be the higher than the aggregated severity score from the other indicators. Now, one of the elements that created a few headaches in the implementation of JIAF 1.1 last year is the use of magnitude and degree indicators. First, some definitions. Magnitude refers to the number of people affected. On the other hand, intensity is the degree of severity. Because those terms are not always mutually exclusive, in the JIAF we refer to indicators either at area level or household level. The distinction that is actually the most important is how thresholds are determined. If the threshold for an indicator is based on the proportion of people who fall into a specific group, then the indicator is magnitude-based, regardless of how it was collected, even if it was collected through a household survey. On the other hand, degree-based indicators have household-leveled thresholds. Effectively, all degree-based indicators are collected at the household level, but not all indicators collected at the household level are degree-based. For example, the indicator looking at distance to the nearest health facility is based on thresholds on how many people live more than 1 hour's walk from the nearest facility. Though this indicator is collected at the household level, the indicator is actually magnitude. More rarely, and this is where it gets actually quite tricky, there are a few indicators that are degree-based, so intensity, but are collected at facility or area level. For the moment, these indicators should be classified as magnitude because they can be more accurately aggregated that way. All right, let's see if this made sense. Here's a little exercise. Is this a magnitude or a degree indicator? Please do take a moment to reflect. Is the percentage of households with at least one member with a disability by severity, is it a magnitude indicator or is it a degree indicator? How do you decide? Please stop the presentation for a few minutes to do the exercise. And here are the answers. How many did you get right? Those indicators were actually plucked from the data collection and data aggregation templates. And if you go and check them out, you can see the thresholds for the severity, and it will give you some additional information and understanding, hopefully, on the difference between degree and magnitude indicators. Now, as promised, here are the key documents and supporting tools that you need to be aware of to implement the JIAF. So 5 important resources. First, the JIAF indicator reference table, I've mentioned quite a few times. It compiles the key set of indicators put forward by each global cluster for the JIAF. It's a live Google spreadsheet. We update it when necessary. Those indicators are the ones that are used throughout the framework, but focus quite heavily on the humanitarian conditions indicators. Out of 123 indicators, 97 are nested in the humanitarian conditions. Now, to get more guiding indicators for the analysis of a context, shock, and impact pillars, please refer to Annex 3 of the guidance. And in the annex, there is also a link to a longer list of indicators that will help you for those first 3 pillars. The third resource is the template for documenting the selection of indicators and information gaps. And then you go into the last 2 companion documents, companion tools that are the JIAF Scenario B aggregation template and the JIAF Scenario B data collection templates. Those 2 tools will actually be explained more in depth in the aggregation and pin sessions. Finally, a few more links. First, the HPC 2022 facilitation package, of which the JIAF 1.1 guidance is part of. Secondly, two bits of information. There is a JIAF help desk that is an interagency platform that could help if there are some difficulties encountered in country in the interpretation of the guidance. The email to use is jiafhelpdesk@gmail.com. Finally, we have a new website, jiaf.info, that you should go and visit. This is where we will be posting updated documents as well as additional resources. This concludes the in-depth session on indicators and severity. Stay tuned for the other sessions.